When we say it's a silent disease, it's silent because we don't really have pain until you have a fracture.
Yeah, the diagnosis was certainly a bit of a shock to me, but having got over that with gaining information from places like the ROS helpline and also the handbook, I've realised that you can carry on doing most of the things you used to do.
Having been diagnosed, I immediately felt relieved. I felt that there was an explanation for the spinal fractures that I'd been told I'd had, for the pain I'd been in for well over a year. And I felt that I would be believed. There was a reason for it, and I could explain to other people why I was in so much pain, why I was finding it difficult to do things. So that was good. But on the other hand, it was quite frightening as well, because I didn't really know what that meant for my future. Could anything be done about it? Was I going to have any more spinal fractures? You know, was I going to go through that level of pain again? And what was the treatment? Were there any treatments out there? So it was kind of a mixture of emotions, really.
If you're going to see a GP or a practice nurse to discuss this, then it's a really good idea to be well prepared before your appointment by reading some information about what osteoporosis is, how important it is to get some treatment, how to take the treatment. And good sources of information are the Royal Osteoporosis Society website, also the NHS website's very good.
The decision to start treatment for me was quite straightforward because I wanted to remain active, and when talking to the consultant, I actually said to him, what would you do if it was you or one of your relatives? And that's usually a good question to ask, and the answer was, well, I would suggest starting treatment, especially if you wish to carry on cycling, going hiking and things like that, the things that I really enjoy. So that was a straightforward reason then to start treatment.
I would recommend that you write a list of questions on a piece of paper prior to attending your appointment. This often makes the consultation more focused and allows you to directly ask the questions and not forget that pertinent one you may have.
What I did do though is when I went to my appointments with even the GP, the NHS consultant, the NHS nursing team, which I saw several times, I was always prepared with questions, even if I didn't get to ask them. Take a notepad and pen, and I always carry around my medical file with me, so they're often asking for dates of when you've had this and when you've had that. So I always sort of take that with me to make sure I feel really prepared and make sure I can take notes as well. So I always do that, and I just feel like I want to be really organised and keep records of things.
Most of the side effects do resolve within a few days, at most a week or so. If unfortunately you have had side effects from the medications which have lasted for a period of time, please speak to either your GP or clinical pharmacist about the options. There are other treatments available to treat osteoporosis, and they will be able to discuss these with you.
If you are having any issues, etc., you should go and speak to your doctor, because there are alternatives out there if you're having a problem with what you've been prescribed with to start with.
I went to the doctor because I felt that I was having tummy troubles and indigestion troubles, and I didn't feel that the treatment was helping me. So I went along and had a word with my doctors, and I spoke to the nurses at the Osteoporosis Society, and they decided that I should go back. So I went back to the specialist, and he said, we'll change the medication and we'll give you an infusion once a year, and you shouldn't have those side effects, which I didn't. And I've been very good since.
Any treatment will require you to consider all the pros and cons, and a decision does not need to be made at that time. Most GPs will be happy for you to come back to them with your decision after you've had a period of time thinking about it.
Everyone's different. No one's going to force you to take any treatments for osteoporosis. And if you are really worried, then a conversation with your doctor is absolutely vital. But whatever resource you're looking at, which is not a recommended source, you're going to find a lot of negativity about possible side effects, the ones which are really, really rare, and that might skew your view. But the long-term view for you is, if you can take these medications and the side effects are mild, then you're going to get lifelong protection for your bones. And if you do fall in later life, you're much less chance of having a fracture and reducing your mobility, and the rest of your life would be impacted by that.
When I was first diagnosed with osteoporosis, it was a real shock, and it was a worry about what was going to come in the future. I did lose some of my confidence in terms of veering too far from home, travelling, doing some of the things I like. But when I started to get some treatment for it, so the romosozumab and then alendronic acid, I feel like I'm doing something now, something proactive about treating the osteoporosis.